hip replacement surgeries and walking better later after the surgery. Yes, it is possible. Hi, myself Dr. Jayakrishna Reddy. I practice at Yashoda Hospitals, Secunderabad. I am joint replacement and sports medicine arthroscopy surgeon. I also do complex trauma. So most of the patients come to us with the hip complaints. Few people require surgery, few people just require rest and medication and physiotherapy. The surgery people who all required surgeries, it can be because of arthritis of the hip joint, or the arthritis is because of the inflammatory arthritis, rheumatoid arthritis, or gouty arthritis, other seronegative arthritis, or it can be elderly people, senile osteoarthritis, or it can be avascular necrosis. That means the blood supply to the head is reduced due to, there are multiple reasons for that. So in such cases, or people who are born with a defect hip, it can be a partially dislocated hip or a shallow cup. So all those people can land up in osteoarthritis of the hip, either primary or secondary. Yes, such kind of people can walk very well like any other person, provided, again, if you diagnose it properly, what's the cause of the arthritis, and we have to check the shape of the cup in the hip and the ball also, all those things. Based on that, if you do a hip replacement, it can be cemented or uncemented. Usually younger people, we go with uncemented up to age of 70-75, and later we may do a cemented hip replacement. Uncemented hip replacement lasts long, and the bone gets incorporated to the surface of the implant, so the hold is much better and longevity is better. And the cemented one, yes, the life is less, so that's the reason we do it in the later stages of the life, maybe after 75 years. And after hip replacement, yes, you can sit on a low chair, you can climb staircase, you can do swimming, you can do cycling, you can do treadmill walking, you can do gym exercises also. It's not that it's going to limit your routine activities. Maybe except running, most of the activities you can do are not contact sports also. So hip replacement, it's a routine surgery. You can get back to your routine activities. You need not think that once implant is there, what's going to happen later. So it's a safe surgery. You can very well get it done.
If you found this video useful, like, comment, and subscribe for more health updates.